Hi, this is Scotty, and welcome to week 15. So I think the end of our practicum is almost upon us here. I just wanted to try to talk a little bit about social justice, which we're all aware is one of social work's most prominent values, and a phrase that we hear very often. Um, and what I wanted to talk about specifically was the relationship between social justice and clinical social work. Um, Most of us are following a clinical path, um, and there's been a lot of arguments in the literature about the the relationship between clinical social work and social justice. So that's kind of what I wanted to touch on a little bit today. Um, to me, I think that clinical social work is one way in which we achieve social justice, but one person at a time. Um, if you define social justice as trying to seek equality in opportunity and the basically the um, rewards of living in society, then you can look about how we do that in clinical social work. Let's say someone isn't able to participate fully in society and advocate for themselves because they suffer from a psychiatric disorder. Seeking to not only treat them and help relieve the symptoms of their psychiatric disorder, but also teaching them skills such as advocacy and connecting them with resources that make it a little bit easier for them to climb the social ladder, so to speak, then I think the clinical social worker is performing social justice. Like I said, there's been a lot of writing in the literature about how difficult it may be to find a social justice perspective in clinical social work. The macro level seeks to change society to make the society more open to social justice and equality. And again, I would argue that clinical social work makes the individual or helps the individual become a more equal participating member of society. So I hope that makes sense. So in a sense, you have an intersection of micro and macro social work. You may empower the individual client to empower others who, they may form a group and become socially active and may force social change in their community. So I think clinical social work can and does have quite a social justice perspective. And once we think about the importance of the therapeutic relationship in the therapeutic setting, what more is what is a more equitable relationship than that between the therapist and the client, especially when we look at relational cultural theory and therapy, and how the role of the therapist and the client is mutual empowerment and mutual empathy. So in a sense, again, I would argue that the clinical social work relationship is and this clinical social work profession is one that engages in the advocacy for and the creation of social justice, but one client at a time. So um, I've been trying to get through this without coughing. I think I've gotten a little bit of someone's illness, but I guess my question for the group this time is, especially those of you that are looking forward to a career in clinical social work, how do you see yourselves in embracing the value of social justice? Thanks, and have a good week.